Hello, my name is Vanessa. My topic of presentation today is energy conservation and work simplification. So when it comes to energy conservation, the goal is to educate and instruct the patient to preserve energy during an activity such as ADLs or IADLs or even functional mobility so that they can get through to the end of the task. So essentially, essentially what you're doing is teaching them ways to preserve their energy to slowly accomplish what they need to accomplish, and that's going to be through multiple steps, okay, that we're going to teach them and educate them throughout the intervention. So what we want to do is minimize dyspnea, which is the shortness of breath, improve their functional activity tolerance, and that's going to be through the means of using these energy conservation tools. Okay, so first, what we want to do is educate the patient in effective breathing patterns. And you can do this by either teaching them deep breathing via pursed lip breathing, the pursed lip technique, or you can teach them the diaphragmatic breathing in order to improve their activity tolerance. Okay, so that's the goal. If they have improved functional activity tolerance, they can get through the task at hand with less observed shortness of breath and fatigue. Okay, when someone's short of breath to a certain degree where their oxygen saturation is lowering, these people can become very lethargic, dizzy. They can have episodes of shortness of breath, fatigue, okay, and that will give them a generalized weakness where they would have to cease the activity, sit down as soon as possible, and recover from those symptoms. So that's what we're trying to avoid, getting to that point where their safety is at risk. People are at increased risk for falls and things of that nature when the oxygen saturation is lowering. A lot of people can even be asymptomatic. They don't have symptoms of this dizziness or perceived, shortness of breath. So they kind of just keep going. And then those are the people that are at risk for falls. Okay, so we want to teach them and increase their awareness. Okay, so that's going to be another point here, is increasing their awareness of signs and symptoms. Within this subject, you definitely want to talk to them about those signs and symptoms that they want to be careful with and prevent. If they do happen to feel them coming on, if the person is on oxygen, you want to teach them and the caregivers how to monitor their oxygen with a pulse oximeter. Okay, teaching them what are the normal ranges, how frequently to check, and you also want to teach them safety within their oxygen tanks, concentrators, checking those lines, make sure there's no buildup within the line that's decreasing their oxygen flow, or any kinks in the line. Make sure when you're going to the homes, they should only have 50 feet of cord maximum. A lot of times they put 3, 4, 5, 6 cords together, these cannulas, just to get from, let's say, the living room to the restroom, but that's decreasing the amount of oxygen that they're getting within that minute. So it's not really conducive to them. So training and education to both patient and family is crucial. You also, as a therapist, want to know how and when to grade activity. Okay, so you want to meet the patient where they are and slowly upgrade the activity. But if it's needed to downgrade the activity or the task to make it accomplishable for the patient, that's also something that we need to do, okay? We don't want to teach them effectively, when you feel like this, stop everything you're doing, because it's not realistic, it's not life. They still have to get things done. So you want to teach them how to incorporate rest breaks. Rest recovery breaks. When to take them, for how long, monitor their symptoms, monitor their oxygen saturation if they are on continuous oxygen, or if they have it PRN. You know, if you're below, doctor's orders would usually indicate 92%. So if they're below 92% or 90%, you know, that's the time that we want to get that oxygen, maybe even before then, okay? So teaching them that. Okay, so these are effective ways to teach energy conservation. Educate them in breathing retraining, so effective breathing patterns via pursed lip techniques or diaphragmatic, which is that belly breathing. Educate them, signs and symptoms. If they know what to look out for, they're more inclined to stop and try to recover from those symptoms before continuing a task, putting themselves at risk, okay? Grade the activity, give them confidence, and this is the way we do things. It's okay when we need to downgrade. The thing is to be safe, okay? And when they're at home, we don't want them pushing through, even though they're fatigued and short of breath, okay? And then rest recovery breaks. So that's really important, teaching them to take those rest breaks, when to stop, and definitely not assuming the task until they feel fully recovered, okay? Another way to implement energy conservation and rest is going to be sitting when possible. So whether it's dressing, bathing, cooking, okay, they can do even leisure in sitting. Sit when all possible. Sit to peel potatoes, sit to cut veggies, sit at the sink side to brush your teeth and brush your hair. Okay, these are the things that we want to educate and really push with our patients so that they understand that, you know, they're in a phase of recovery and rehabilitation, and we need to take it slow while the body recovers, and they improve their strength, their muscle endurance, and lung capacity, okay? As far as task simplification or work simplification, what you want to do is teach the patient to break down the activity into smaller steps and condense it, okay? So let's say if you like to do your makeup, minimize that makeup routine from 15 different products. Let's see if we can get it down to 7, okay? We need to minimize the task so that the task is shorter, easier to manage, and with less steps as possible, so that we're still effectively getting the task done. We have success in that area, but it took less energy due to their higher risk or disease process. We want to teach them, we still have 10 things to do within the day, but let's try to shorten them as much as possible. So you can do that like with dressing. Teach them to plan ahead. The night before, take out their clothing and put it within arm's reach. So it's one less step, okay? Sit when possible, okay? Edge of bed or even lying down if sitting up is a lot of energy. You want to teach them lower body dressing first because it takes the most energy, okay? Teach them lower body dressing of pants and underwear at the same time. So they're only standing once. A lot of people put the underwear first, stand up, pull it up, sit back down. Pants, stand up, pull them back up. So you want to teach them to do that together at once. And then also light, loose fitting clothing.